Good morning and welcome back to GP Video Podcast by Nadia. On my way to clinic, I just wanted to make a very quick video and then I'll come back to its explanation in the other videos. So, what are the 5 blood tests that are essential that everybody should get at least 3 to 5 years? And one of them is the one that you should at least get once in your lifetime. But 3 to 5 years, yearly, it depends on the age. Like if you are 20 and above, 30 and above, 40 and above, and I'll come to the explanations of all of that how frequently should you get the blood tests done, the ones that I'm going to mention, yearly, 3 yearly, 5 yearly. But yes, definitely one of the 5 that I'm talking to you today about, one of them should only be gotten done once in your lifetime, because that is that wouldn't change then. Okay, so let's start. So number 1 is full blood count. Full blood count includes the number like your hemoglobin, your white blood cells, your platelets, and your red blood cells. And that is very important. Why is it important? We'll again come back to it in a detailed video. Number 1, FBC, full blood count. Number 2 is HbA1c. HbA1c is the glycated hemoglobin, which shows whether you are a diabetic or not. This is also a very important test that should be tested regularly. Number 3 is total cholesterol profile, like full cholesterol profile, which includes total cholesterol, LDL, which is the most dangerous, HDL, triglycerides. So all of these should be done regularly as well, which is called total cholesterol profile or full cholesterol profile. So number 1, full blood count. Number 2, HbA1c for diabetes. And number 3 is total cholesterol profile. While number 4 is EUC, electrolytes, which include sodium, potassium, urea, creatinine. These are very, very, very important for renal function or kidney function testing. Number 5 is the one which I said you can only get it once in a lifetime. You should only get it once in a lifetime because that's not going to change, but you should definitely get it. And that was a new information for me as well. That is called lipoprotein A. So what is lipoprotein A? Lipoprotein A is a carrier that carries cholesterol throughout the body. And if it's higher in your body system, which is genetically related, then you are at much more increased risk of developing heart attacks. And if you find that you have increased lipoprotein A, then we have to aggressively lower your cholesterol levels. So these are the 5 ones: full blood count, EUC, which is for renal function, HbA1c, which is for diabetes, full cholesterol profile, which is for cholesterol, and number 5 is lipoprotein A, which is again for cholesterol, and it's only done once in lifetime, while the other 4 tests can be done yearly, 3 yearly, 5 yearly, depending on your age and comorbidities like other diseases that you suffer from. See you soon. Good afternoon and welcome back to GP Video Podcast by Nadia. So this morning we were talking about the 5 most important blood tests that everybody should get done, especially people aged. So I was going to tell you about the time duration. So the 5 blood tests are full blood count, kidney function test or electrolytes, urea, creatinine, then total cholesterol panel, HbA1c for diagnosing diabetes, and lipoprotein A. Among these, FBC, EUC, HbA1c, and total cholesterol panel can be repeated always whenever within the guidelines timing. But lipoprotein A is usually done only once in your lifetime because it is genetics related. What is lipoprotein A? Lipoprotein A is a carrier that is a protein carrier that carries the cholesterol around, and if it's high according to the numbers, then what we need to do is we need to be very vigilant about other risk factors of heart disease, because we can't do anything about lipoprotein A because it is a genetic component that is present there. But what we can do is we can aggressively lower the blood cholesterol levels. We can take care of the sugar levels. We can take care of the blood pressure. We can take care of the obesity. We can take care of the physical activity and all the other risk factors which are there for heart, because excess lipoprotein A puts you at risk of developing heart attack at a very early age. So what is full blood count? Full blood count includes all the blood cells like red blood cells, white blood cells, platelets, hemoglobin. It shows us if you've got anemia, if you've got leukemia, if you've got increased inflammatory markers like white blood cell count. So full blood count is a very important one. Then we have EUC, which includes electrolytes, urea, creatinine. Electrolytes include sodium and potassium, and also that reflects the kidney disease, basically the kidney situation. Then total cholesterol panel, as I said, it's very important to keep a tab on the cholesterol panel, and if it's high, we need to lower it by lowering down our weight, by increasing our physical activity, by controlling our diet, and by doing the medications if necessary. And I've already spoken about lipoprotein A. There are two other tests that I usually do on all my patients. If I tell you the truth, when I started working as a GP, because I had come from hospital background, so I used to do a lot of blood tests on my patients, and I still do them when I think it's necessary, or I actually do a lot of blood tests on my new patients, depending on their history. But now the more I read the guidelines, the more I think why they are not that much necessary, and why should I be only doing them conditionally. But there are two other blood tests that I usually do on all of my patients. Number 6, which will be in this list, will be number 6, which will be liver function test. I'm very much interested in liver function test, but it is not routinely suggested until and unless a patient is overweight or is diabetic or has got alcohol abuse disorder, misuse disorder, or if the cholesterol is high, then we can do, they say that we can do it secondarily. If the cholesterol is high, then we can do it. If the patient is diabetic, then we can do it. Or if a patient has got history of alcohol use, then we can do it. Or if a patient has got any family history or is overall kind of very obese, so we can do it. But I usually do liver function test on everybody. And number 7 is calcium phosphorus magnesium. So this also I do routinely on my patients. Apart from that, if somebody is lethargic, we will also do thyroid testing, we will do vitamin D, we will do B12, we will do iron, we will do magnesium. We've already included in CMP. So apart from these 5 blood tests, I also do liver function tests routinely, and calcium, magnesium, phosphorus. But again, they are not routinely advised. So how often should you do it? Between 18 and 35 years of age, if you're generally healthy, then you should do these blood tests only once. And after 35 years of age, you should do them every 5 years. So this is what the guidelines say. Between 18 and 35, at least once, and above 35, every 5 years. But of course, if you have any sickness or if you have developed any medical issues, then you should get them done more frequently or more routinely. So these were the blood tests. And what else did I want to talk about? I've got a very good question to address, which I might address in my next video, is that if cost is a problem, if somebody is millionaire and would like to do all the blood tests in the world just to see how are they, then again the answer is it is not practical, number one. And even if it's practical, and even if the costs are all okay to be done, like okay to be paid for, there is this concept of false positive and false negative, which we should keep in mind, and I will talk about it in my next video.